Asmita, and this afternoon we are going to have a discussion on a really important topic. Before we begin, I want to give our audience a general insight into BabyChakra, what platform is about. So, BabyChakra is the largest pregnancy and parenting platform. It is a one-stop destination for pregnant women and expecting parents. BabyChakra tries to connect parents with experts who bring valuable information and research based information to all. On that note, I would like to kickstart our topic for today. We are going to have an informative discussion today on the best diet for PCOD, PCOS, and this is PCOS episode 2. And we have an amazing guest speaker. Please welcome Priya Kathpal, a nutritionist. Hi, Miss Priya. Welcome.
Hello.
Hello, so nutritionist Priya Kathpal has a master degree in dietary food service management with a postgraduate diploma in dietetics, BSc. Applied nutrition is a is also a certified sports nutritionist and yoga instructor. With over 15 years of experience in fitness industry, she has been involved in clinical and sport nutrition consultations in corporate, gym, fitness centers, clinic setup, and R&D team of sport nutrition products. So, in continuation in to our episode 1 on what is PCOS, PCOD, here we are with our episode 2 on the best diet of PCOD, PCOS, and this is PCOS episode 2. A proper diet and nutrition can help PCOS patients to lose and manage their weight along with controlling their insulin levels as well. Most experts agree that a high protein and low carbohydrate can help in dealing in weight and insulin issues. So before we start, please ask your queries in the comments and your expert Priya will be answering them shortly. So Priya, can you throw a light on why diet is important in PCOS, PCOD?
Okay. See, even though both the terms sound very similar and are used interchangeably, PCOS and PCOD, but they are a little different. I'm sure you have covered that in the first episode.
Yeah.
Like the PCOD is disease, very clearly, though the PCOS is a syndrome. The word syndrome usually says there is more than one thing happening in the body. But having said that, the dietary changes and the dietary needs are also pretty similar, like the changes and what we need to do, what are the things we need to keep in mind. Now, why is diet important in this case is because in both the cases, there is hormonal imbalance,
Okay.
because of which there is irregular periods sometimes, or there are lack of periods sometimes, or there is also weight gain. All this is connected to your diet also. So when you make the dietary changes or you make the lifestyle changes, it becomes easier to maintain or at least keep the PCOS and PCOD in control. So basically bringing back your hormones in place, balancing them out, getting your periods regular, all this is possible by a good lifestyle and good nutrition. That is why the diet change becomes very, very important in this condition.
Okay. So there are some questions. Uh, are there any specific food to avoid when having PCOS?
Yes. So PCOS and PCOD may usually there is insulin resistance in the body.
Okay.
इंसुलिन रेसिस्टेंस इन अ वेरी सिंपल टर्म इज जब आप कार्बोहाइड्रेट्स खाते हो या आप नॉर्मल फूड जो आप खाते हो तो वो एनर्जी देता है. वो एनर्जी कितने टाइम में आपके बॉडी में रिलीज होता है फ्रॉम दैट कार्बोहाइड्रेट फूड इज बेस्ड ऑन द इंसुलिन हार्मोन इन योर बॉडी. Insulin resistance, the resistance word means ki somewhere this work is not happening properly. If this is not happening properly, which means we need to make sure that we are giving good quality carbohydrates to our body. Now,
Okay.
what you should avoid, anything which is high glycemic index. Now, what is glycemic index? Again, आपके बॉडी के अंदर शुगर रिलीज कितना इजीली होता है किसी
Can you,
फूड से.
sorry
Yeah,
to
sure,
interrupt, like,
sure,
give me 1 second, you answer it. I'll
yeah,
just be back in a second. Yeah.
sure, no problem. I think we can continue till she comes back. So we were talking about glycemic index. So glycemic index is basically, how easily the sugar is broken down inside the body. तो आप जब कोई फ्रूट खाते हो, कोई वेजिटेबल्स खाते हो, कोई दूसरा खाना खाते हो, हर एक चीज का एक ग्लाइसीमिक इंडेक्स होता है कि शुगर कितनी जल्दी बॉडी में रिलीज हो रहा है. We want to eat all the foods which are lower on the glycemic index, or at least not very higher on the glycemic index. It can be moderate to low. Now, what are these items basically that are very high on glycemic index? Anything which is high in processed sugar, anything that is processed even from natural foods. Like for an example, eating an orange will have lower glycemic index, but उसी orange को जब आप juice में convert कर देते हो, the fiber goes away because most of the time you strain it. So then it becomes a high glycemic index. So we need to have foods in their natural form. Jitna ho sake with peels and skins. Like if you're having cucumber, try to have it with the peel. If you're having apple, try to have it with the skin. Having lots of pulses, grains. So these are the kind of items जो आपको include करनी है, and जो आपको avoid करनी है वो है processed items. मैदा, breads, white sugar, refined sugar totally, anything which is highly processed in the market, packaged. This is something that you want to avoid as much as possible in PCOS and PCOD.
Okay, so the next question here we have is, does irregular dietary pattern have a negative effect on PCOS management?
Absolutely. So, like in the beginning, I said if you have PCOS or PCOD, you are going to have some level of hormonal imbalance, which
Hmm.
will lead to irregular periods, which will lead to weight gain because आपके बॉडी में जो हॉर्मोन्स हैं, फीमेल हॉर्मोन्स जो हैं वो कम हैं और जो मेल हॉर्मोन्स हैं वो ज़्यादा हो रहे हैं, depending upon what kind of syndrome you have, whether you have PCOS, PCOD. But the crux is that the hormones are going to be imbalanced. And if you are not taking care of your food, you are not able to maintain your lifestyle, this will worsen. If
Okay.
it is worsened, obviously taking control of your disease or your syndrome is going to be more difficult. In fact, PCOS, the syndrome, is also people who have PCOS are also at higher risk of metabolic syndrome, diabetes, which means if you are not controlling the PCOS at the right time and taking care of your weight, your lifestyle, you will end up risking your body to either have diabetes or metabolic syndrome at a later stage in life. So definitely a negative dietary pattern is not going to help in the longer run.
Okay. So, how PCOS can be controlled with diet?
So like I was talking to you about what kind of foods we should be consuming.
Yeah.
आपने बिगनिंग में जैसे बताया कि lot of people have said or even experts know that high protein, low carb diet helps. How
Yeah.
does it help? Now, when your body is insulin resistant or when your hormones are imbalanced, we are not able to process the carbohydrates as well as a completely healthy body. तो जब हम कार्बोहाइड्रेट्स को रिड्यूस कर देते हैं, then the body is able to utilize that carbohydrate much better and the insulin resistance starts getting better. Proteins take much longer time to get digested in the body. So
Okay.
आपका जो BMR है वो improve हो जाता है. What is the BMR? आपका energy burning capacity improve हो जाता है. When this improves, your muscle mass improves, your hormones improve, आपका जो weight gain है वो reduce होता है. Basically, you start losing weight,
Oh.
and your periods start getting regularized. When all this in a circle is brought back into a chain, then your PCOS is getting in control. PCOS and PCOD do not have any long-term cure. Only thing you can do is manage it with your diet and lifestyle. So when you are able to do that by the various kind of foods, like there is something called as seed cycling. जो
Hmm.
आपके सीड्स होते हैं, आपके पंपकिन सीड्स, फ्लैक्स सीड्स, चिया सीड्स, इन सब में ईस्ट्रोजन को मेंटेन करने का एक they have the property to maintain the estrogen in your body. So they become very important in a PCOS dietary lifestyle. Okay, they also in fact help in infertility. So these all items, when included in a diet where PCOS is when we are trying to manage PCOS, all this is going to help control the condition, and you will be able to lead a healthy life without any hormonal imbalances and irregular periods.
Okay. Also, is keto diet, intermittent fasting, or any other forms of diet good for weight loss for women suffering from PCOS?
Okay, so yes, ketogenic diet and intermittent fasting, all these are helpful. There is no doubt about it. But we also have to understand that keto diet is very high on fat. It is
Okay.
very low on carbohydrates and is moderate or high on protein. Now, one is it needs to be planned in a very, very correct way under guidance.
Mm.
Because when we are saying a high fat diet, we need to consider good quality fat, especially for a PCOS or a PCOD patient. Because if the fat quality is poor, you end up having high cholesterol in the longer run. You will end up having risk of heart diseases in the longer run. So, keto diet can definitely help, but we need to make sure it is done under guidance. Because, see, for an example, I can have PCOS and you can also have PCOS, but still, our reports can differ very much because we are individual people, and our backgrounds, our medical history, our genetic conditions, our environmental factors are different. So,
Right.
it may work for me and it may not work for you, or vice versa. So it
Right.
is not a general thing that keto will work for all PCOS patients or intermittent fasting will work for all PCOD patients. No. It can work, but one has to figure it out if it is the right diet for them under the guidance of a nutritionist and a doctor, because it is a planned diet. Now in intermittent fasting, suppose someone has very bad case of acidity or gas. Having fasting for 18 hours, 16 hours may not be a very good thing for them. It may give positive results to someone else. So,
Okay.
in a general lookout, yes, they are both very helpful to maintain a good lifestyle. But it cannot be a blanket statement that it will help all the PCOS and PCOD patients.
Okay. So our next question is, can I have milk in PCOS?
So, milk and meat generally is not totally stopped, but because we have hormonal issues in PCOS and PCOD, अभी जो मिल्क हमारे मार्केट्स में अवेलेबल है, a lot of times there is issue of hormone inducing into meat and milk. We don't know how pure this meat and milk is that is available in the market, and this is why a lot of times it can have adverse effects in a PCOS or PCOD patient. Having said that, I will not say chuck out totally, आपको पूरी तरह बंद करना है ऐसा नहीं है, but I would rather prefer that the quantities are less or they are taken in moderate quantities so that you don't see any major negative impact on your bodies.
Okay. So any more questions? We'll just wait for more questions.
Sure. I would like to add, a little bit about supplements. In
Okay.
PCOS and PCOD patients, certain supplements are very, very helpful, like vitamin D, primrose oil, and the seeds that I was talking about, the flax seeds, pumpkin seeds. All these help a lot in maintaining the lifestyle. Another very important lifestyle change that a PCOS PCOD patient should do is doing strength training in their daily routine. So, exercising, especially strength exercises, are very, very helpful in getting PCOS in control. So, this is one message that I would like to pass on to all the women, even if they are not suffering from PCOS. It is important to include strength training because that improves your muscle mass. एक बार आपका muscle mass improve होता है, आपके लिए वेट लॉस इजी हो जाता है, आपके hormones बैलेंस हो जाते हैं, आपके पीरियड इश्यूज सॉल्व हो जाते हैं, and in the long run it is very good for your bone density. So I would like this point to be noted that most women should include strength training in their regime, especially the PCOS patients.
Okay, I hope most of the questions are answered so well. So we will like to end our session here. So thanks for joining us today. The tips you have provided are extremely helpful, and I'm sure all moms will find them useful too. So with that, we come to an end of our live session. Thanks to our wonderful viewers who joined us today, and thank you, Priya ma'am,
Thank you
for
for having me. Thank
sharing for sharing so helpful pointers with us. And do keep us following on Baby Chakra, and stay tuned for more helpful parenting videos and tips.
Thanks a lot.
Yeah, most welcome.